into a 10-day quarantine period. But I wanted to update all of you on where we are in state and what we are looking at over the course of the next number of days and weeks. We continue to see record-breaking ICU capacity, hospitals that are getting filled up, a surge that we are experiencing, not dissimilar to other parts of the country, but putting real challenges on our staffing here in the state. You can see from this slide the staff that we have currently deployed. These are state staff specifically to now 75 facilities in 24 counties. You can see the kind of staff that we are utilizing, our health corps staff, the California National Guard, as well as contract staff and our CalMat teams, very familiar. Any of you have tuned into these presentations over the course of the last number of months, and working with Health and Human Services at the federal level, these DMAT teams. And I'll talk more about DMAT and some of the requests we have in with the federal government in just a brief second. As it relates to the federal requests, specifically around DOD staffing, as well as that DMAT staffing, one of the things we're trying to do is extend the DMAT staffing that we currently are enjoying down in Imperial County. They're due to redeploy elsewhere in the middle of this week. I had a very good call with the Vice President. I want to thank the Vice President for his responsiveness, for reaching out to get those DMAT support, or rather get that DMAT staffing and support extended through January. We're just waiting for the final determination on that, but it looks very, very favorable. We also talked more detail about these Department of Defense teams. We have specific asks out for 10 teams of 20. We are currently able to identify 75 personnel that will be deployed, currently have not, but are about to be deployed to critical sites here in the state. We're also working with HHS. We talked yesterday with a number of representatives from HHS about this monoclonal antibody strategy, and they're going to be providing some resources to do some infusions, what they refer to as their infusion teams. And that also will be deployed over the course of the next number of days. As it relates to what we currently are doing in alternative care sites, the alternative care sites are pre-identified. We have 11 of them all up and down the state of California. I mentioned on Friday the warm status on a number of sites that are not on this screen, though the 4 sites that are up on the screen are not only in warm status, they're now in active status. The others in warm status, these specifically in active status. We now have 62 patients in these alternative care sites. On Saturday, I was out there at the Sleep Train Arena in Sacramento. They had 17 patients on Saturday. They have 16 COVID positive patients today. Not all of the patients, those 62, are COVID positives. The ones at the Sleep Train Arena are, but you get a sense. Imperial Valley College, the Porterville and the Fairview sites, these are sites that are currently have been activated, and we will provide more staffing. As we provide more staffing, we'll allow for more patients to make their way in to these critical facilities. 37,892 is the last reporting period, total number of cases, tracking slightly below the 43,901 average number of daily positive cases that we have experienced over the last 7-day period. Now, some have inquired over the course of this weekend, the last number of days, suggesting or at least inquiring as relates to what they perceive based upon the data that's come in the last 4 days, that we may be seeing a modest, very modest decrease in the growth rate, total case growth rate. Still too early to tell, and I caution people not to read in again to weekend numbers, but we'll take a close look at this in the next few days, and of course make that data always would make it available, but to give you our assessment, professional assessment. Dr. Galley will talk in a moment. He can give you a side of that as well to see if he thinks that is indeed the case. Still too early to tell, but nonetheless, good to see the number the last 24 hours tracking a little bit below that 7-day. Let's take a look at the 7-day testing average. little over, or rather just shy, I should say, of 330,000 tests. By the way, yesterday, we reported over 395,000 tests, so close to 400,000 tests in the last reporting period. But you take a look over a 7-day average, roughly 330,000 tests. Want to still see that test number increase. We're starting to see those numbers increase, which is encouraging news. You get a sense of course, the positivity rate now in the state, 12% positivity. That's over a 14-day band. Let's take a look as we get to this next slide, where we were just 14 days ago, though. That 12%, we were at 8.7% just 14 days ago. So you see that rate of growth, that trajectory growing rather acutely. Hospitalizations, not surprisingly, 63% increase over a 14-day period. You're seeing that same trend line, 17,190 individuals hospitalized that are identified as COVID positive currently in our hospital system. The ICUs tracking with 3,644 patients now in the ICUs, a 51% increase in admissions as well over a 14-day period. The death rate is climbing as well. Sober reminder of how deadly this disease is and how tragic the loss of every life is, but particularly those lives that are lost during the holiday seasons with loved ones and family members torn asunder because they don't have their loved ones at home or even the ability to call. And so I just remind people of this fundamental point, and that is this disease remains deadly. And just take a look at the lives that have been lost just over a 14-day period, 2,741 people no longer with us, just over a 14-day period, an average now of 233 lives lost on average every day over the last 7 days. Again, those weekend reporting periods often lag. The 83, though extraordinarily high, I know looks to be more modest compared to the average, but that often is misleading on a Monday. And the reporting period's really the average daily rates that we should be very, very mindful of. 233 lives lost over that period. Here's a chart that more and more people are getting familiar with, and that's the regions in the state that are in a scarcity frame, now in a surge frame as it relates to ICU capacity. 2.5% is the statewide ICU capacity. That's in the aggregate. I always say this, and forgive me for saying it yet again, none of us live in the aggregate. So that's nice to see. 2.5% is low a number as that may appear to be, doesn't mean much if you don't live in a region that is also detailed and exampled here. And that's why we include not just the state number, which could be misleading, but if you're in the Bay Area, 13.7% ICU capacity, Greater Sacramento region, 16.2, northern part of the state, the northern regions of the state, a little higher at 28.7, but you can see the real hotspots right now. San Joaquin Valley at 0%, and in Southern California, the most populous part of our state, at 0%, now in the surge phase of the ICU planning. So again, just because it's at 0 doesn't mean there's no ICU available. It means we're now in the surge plan. 20% plus or minus is the surge capacity pursuant to the plans that we have socialized and are now being utilized and advanced in those critical regions here in our state. Surge capacity pursuant to the plans that we have socialized and are now being utilized and advanced in those critical regions here in our state. Take a look at the regional stay-at-home map. 98% now of the population in the state represented in the update. San Joaquin Valley, Southern California, Greater Sacramento, and Bay Area. Again, it's just the northern part of the state that's not in that stay-at-home. You can see as it relates to the stay-at-home that we are likely, I think it's pretty self-evident, going to need to extend those original dates. You may recall that the expiration in San Joaquin County was on the 28th of this month, in Southern California the 30th of this month. Based upon all the data and based upon all these trend lines, it's very likely, based on those current trends, that we'll need to extend that stay-at-home order. You recall it was a 3-week order when we announced it a few weeks back, just previewing the likelihood of those stay-at-homes being extended, certainly in those two regions. As it relates to preparation, we've talked a lot about PPE and the 600 plus million units of procedure masks, surgical masks, as well as N95 masks that have been distributed. We've talked a lot about what's in our inventory, still over 500 million units of PPE specific to just face coverings and masks that are still in our inventory, just because it's important to remind folks the critical nature of ventilators as it relates to the issues associated with the scarcity of ICUs. We still are in possession of an ample supply of ventilators. You can see here over 20,000, not just in the state inventory, close to 14,000 vents, but also vents still available within our hospital system. Good news on Moderna. As of this moment, I can report to you, we'll update you on an hourly basis, or at least over the course of the next few hours. We'll update you at the end of the day. But as I speak, 21 of the 31 sites that we identified for Moderna to have vaccines delivered, and remember, we're working with McKesson to do the delivery. They are the intermediary working for Moderna in terms of the distribution of these doses of vaccines. That first phase has arrived in California, 110,000 doses of the 372,600, or 672,000, forgive me, 672,000 have already arrived. 110,000 of the 672,000 have arrived, 21 out of 31 sites as I speak. And the reason why is not only did they get emergency authorization from FDA, we also had our Western States Scientific Safety Review Work Group, a complement of 17 members, 6 from Nevada, Washington State, Oregon, 11 from the state of California. Again, similar to what they did with the Pfizer vaccine, they unanimously approved the safety and the efficacy of the Moderna vaccine. They did so over the weekend, formally announced it Sunday morning, put a letter that we received late Saturday night. So the Moderna vaccine has arrived, and that is indeed good news. 672,600 to be exact is what we anticipate receiving this week. The 110,000 we already have. As we've said many, many times, this is storage for this vaccine is much easier than the ultra cold storage of Pfizer. This is just cold storage, which is the equivalent of freezer storage for the Moderna vaccine. It's a 22-dose regimen. Like the Pfizer vaccine is a 2-dose regimen, 21 days Pfizer, 28 on the Moderna. And we, of course, are encouraged by the Moderna vaccine in relationship to the storage needs in terms of our distribution, in terms of our logistics. We're now able to get these shipments into rural parts of the state, into parts of the state that are more remote, and that is indeed encouraging. There's also some other advantages in terms of the doses in each vial and the total number that you have to order, 975 versus 100 Pfizer orders versus Moderna orders. If I've lost you, happy to clarify any of that in the Q&A, but nonetheless, just some advantages, not on safety and efficacy per se, but real advantages on logistics for the moment with the Moderna vaccine, which is indeed very, very encouraging. Pfizer, here's just the update, 560,625 doses have arrived in the state of California. We got that first dose of the doses all in, 327,600, all of that arrived last week in the state. And that 560 anticipates, for clarification purposes, the 233,025, the 233,000 that we anticipate arriving this week. They're already starting to arrive, which is good, and we'll update you as to the status of all of that remaining 233,000. As you know, it's 40% below what was originally anticipated, and I appreciate the clarification coming from the federal government, the Department of Defense, in terms of their logistics mistake and owning up to that. Again, no reason to have a closed fist in this moment. All of us need to be humble at this moment. Everyone's doing their best, and I still maintain this is an extraordinary accomplishment for this country, for our nation, for the world, that these vaccines are even going into people's arms, that they have arrived. And I want to compliment everybody who was part of Operation Warp Speed. They deserve credit. The administration deserves credit. President and the Vice President deserve credit for working hard over the course of the last number of months to get these vaccines out and to get them in these states. We are so often arrive in the state of California. And what we are told very clearly, and I have confidence in this based upon the conversations we've had over the weekend and including conversations that my staff had today, we're going to see a stable of the Pfizer vaccine come on a more consistent basis. We don't know the exact number yet, and when we do, we'll let you know right away. But we now have confidence in that cadence. And so for our planning purposes, that will allow us a little bit more constancy, a little bit more ability to phase in and distribute these vaccines on a protocol that was anticipated based upon the plans of our guidelines work group and our community advisory group. I'll talk about them in just a moment. But briefly, I want to just update you. The first week, we did vaccinate, or at least administer, the first dose of the vaccine to 70,258 individuals. 70,258 doses of vaccine were administered last week. We'll keep updating you. These numbers lag just a day or two. We want to make sure we get them, make sure they're accurate. So all those doses came in. Not all the doses were administered. And that's why, again, we are, I think, again, why we're being, I think, generous to the nature of this unprecedented distribution all across this country, and respectful of how hard everybody across the spectrum, federal, state, and local, are working to do justice to really meet this moment head on. As it relates to the upcoming meetings, and I was joking with my staff last night. I said, I feel like a full-time red carpet concierge for everyone that does have access to my direct email and my text messages asking about their aunt or uncle